Greetings, people. You see, a Delvin. Yeah, man, a Delvin. A Delvin. Yo, Medea. Me tell you, Medea. A Delvin. A Delvin. Me tell you, Medea. Listen. I want you to shout it to the people on the mountain top. Tell those down in the valley. Tell them that this is Delvin. And let them know that this is our show. Unscripted, anything goes. Unscripted, anything goes. It name Unscripted, anything goes. Yo! People! Delvin Sadler, my name. Medea. Yo, man. Medea. Straight up. Yo, man. You never... I'm picking on you, my brother. I'm picking on you. I am picking on you. No, Delvin. Big up for yourself, people. Unscripted, anything goes. I want you to tell it to the people on the mountain tops. I want you to tell those down in the valley. Tell them this is our show. It name Unscripted, anything goes. Unscripted, anything goes. Unscripted, yo. Anything goes. Yeah, Delvin is my name. And Medea. Yeah, man. Medea. Big up on yourself, people, and thanks for joining. Thanks for joining Unscripted. Anything goes. Beautiful people. I love you. Yeah, man. I love you. Big up yourself, my brother Kirk Anderson. Delvin. I love you, my brother. Thanks for joining. Yo, the beautiful, the lovely Donna Marie. Yo, Donna Marie. Thanks for joining Unscripted. Anything goes. The lovely Marcia Gooder. Delvin. I love you, girl. Thanks for joining Unscripted. Anything goes. Yeah, man, my sister, you there. Yeah, man, to my brother, Winston Roberts. I love you, my brother. Thanks for joining Unscripted. Anything goes. The lovely, the talented, the beautiful Esmalyn Taylor. I love you, Esmalyn. You know, Delvin already. Straight from the heart. You know, I love you, girl. Thanks for joining Unscripted. Anything goes. Straight up, Sierra. The beautiful, that's my twin. Yo, Raquel Stars. The lovely Raquel Stars. I love you, girl. Thanks for joining Unscripted. Anything goes. Esmelin, what are you saying? I Delvin. Work time for me, always. Yeah, man. Always from me, eh? Oh, sorry about that, girl. I still love you. I love you same way. You know, Raquel Stars, beautiful girl. Yeah, man. I love her same way, you know? I love her, straight up. That if anyone here that is similar to me, that is her. That girl. Quite similar. Same kind of personality, straight up. Yeah, man. I love you, girl. Thank you. Straight up, Tara Patterson. The lovely and the beautiful Tara Patterson. You know, Delvin, love you already, girl. Thanks for joining Unscripted. Anything goes. So we want you shout it to the people on the mountain top. And tell those down in the valley. Let them know that this is our show. It named Unscripted, anything goes. Unscripted, anything goes. Unscripted, you see it. Anything goes. Yeah, man. How I show this? How I show this? Yeah, man. Let them know it. Yeah, man. Unscripted. Anything goes. Beautiful people. I'm your host, Delvin Sadler. and I love you. I love you. Yeah, man. I love you. Metea. Delvin Metea. Straight up. Big up yourself, my brother. Yeah, man. Sylvester Hughes. Thanks for joining. Unscripted. Anything goes. You can sing. Yeah, man. Yeah. As a matter of fact, my son built a studio here in the apartment in the house here. Yeah, he built a studio. Yeah, built a studio. Yeah, and I recorded about one song already. I'm gonna record about a few songs, and I'm gonna put them out. Yeah, I'm gonna record some songs. Yeah, man, we have some melodies we're gonna work with. Yeah. We're gonna record some songs. Delvin is gonna write some songs and record them because this is our show. It named Unscripted, anything goes. The lovely, the beautiful Audrey Johnson. Delvin, I love you, girl. See that? I love you. Yeah, man. Darslyn, Delvin, I love you. Yeah, I really do love you. Thanks for joining. Unscripted, anything goes. Yeah, man. I love you, people. We've got a nice subject matter for you tonight. Yeah, man, straight up. Yeah, man, we always talk about the ladies here, but we have to sometime talk about the man them. We have to talk about them sometime. So, yeah, we're going to talk about the men's health tonight. Yeah, man, how to actually take care of the penis and testicles. Yeah, man, how to take care of your penis and your testicles. That is what we're talking about tonight. And as a matter of fact, it's one of the ladies in the room that sent me this subject matter to talk about. Yeah. So yeah, man, she says it's a very important subject matter because a lot of men don't know how to actually take care of their penis. Yeah, man. Our testicles. So we're gonna talk about taking care of the penis and testicles tonight here on Unscripted. Anything goes. You would think that is something somebody would actually know about. Yeah, man. So that is something men would actually know about. But tonight we're gonna delve into that tonight. Yeah, man, we're gonna talk about that tonight, Beautiful people, love you. I love you. I love you. If you realize Delvin was not here last night, and let me apologize, Yeah, I actually went to see my daughter, and yeah, I had to drive a couple hours to go and see her, and then drive a couple hours to come back. Yeah, so when I came back now, I actually was recording with my son here. Yeah, and then I just fell asleep. Delvin fell asleep. Yeah, so I fell asleep. So my apologies, but it's all right because I slept all day today. So no sleeping for me. No, I am fully rested. Fully rested. Yeah, man, you don't have to worry about nothing, people. Me there tonight. Yeah, I am here tonight. Here on Unscripted, anything goes. Yeah, man. I love your people. You wouldn't know how much Delvin love you. The lovely and the beautiful Judy Han Fagan. Thanks for joining. Unscripted, anything goes. There's my brother Early A. Yeah, brother. Yeah, how you doing, my brother? Yeah, man. Yeah, man. Yeah, man. I was tired, man. Me tell you, I fell asleep. Man, I lie. Me fell asleep. Fell asleep. But yes, as you can see, Delvin now, me look fresh. Fresh. You know how much hours I slept today? I slept a lot today. And then I got up and then I cook. Yeah, man, I cook. I cook. Yeah, man, the wife asked me to cook. So I cook. Yeah, man, I cook some roti. Roti and, what you call it now? What the chicken thing name? Yeah, curry chicken. Curry chicken roti. Yeah, man, it bad. Yeah, man, Delvin, we got bad curry chicken roti today. Yeah, man. My wife said, boy, Delvin, it bad. It bad. Even, nobody likes to compliment themselves when they're cooking up, but Delvin, I tell you, that curry chicken there. Yeah, it's bad. It's bad. Yo, straight up. Yo, even my daughter said this is not gonna last until tomorrow now. She tell me straight up, this is not going to last until tomorrow. By the end of the evening, all of this gone. Yes, Rasta. The lovely Jacinta walk into the place. Come say hi to the people, no? This is just Jacinta. Let me show you Jacinta. Jacinta just walk in. Oh, there's Jacinta. Jacinta. Jacinta went for an evening walk and she's back. The lovely Jacinta. Jacinta, you tired? Yeah, man, roti. Chicken roti. Curry chicken roti. It bad. Man, I like it bad. Even Jacinta come home and said, oh God, this thing is great. It's wonderful. You know, they like to wrap it up in the roti shell thing. But I like to bust it up. Then call it bust up shot. Yeah, man. Cause, you know, I bust it up and then I throw the thing on it and I mix it up. Yeah, man. And I devour it. Oh God, that thing was great. Oh wow. Magnificent. Yeah, man, straight up. Yeah, man, straight up. You don't know already. Yeah, man, we know how to season our thing proper. Yeah, man, we can season food properly. Ask Mr. Archer Johnson. Yeah, man, we can season our thing properly. Yeah, man, we season our thing. We know how to season thing properly. I will know how to boil down that shit and make it taste nice and thick and sweet. Oh God, beautiful, lovely people. Yeah, man, straight up. Yeah, man. So tonight we're talking about the penis and the testicles, the proper way to take care of it, proper caring of the penis and the testicles. And for some reason, some men, you know, they don't take care of it properly. And as a matter of fact, you know, doctors are saying that you're not supposed to shower every day. They're saying they're not supposed to shower every day because the natural protein and natural oil from the skin, you don't want to actually wash it away, you know. So a shower every other day or so forth is good. But you have a lot of men out there like that, you know, them nasty. They're like beard. You have a lot of men out there that don't like to bathe. You know what I mean? And if you look at the male animals, they're just the same. They don't like beard either. You know? So, you know, you can see the correlation. You know, men, they don't like to bathe. You know what I mean? They don't like to bathe. Delvin have to bathe because I like oral sex. You know, I like to, you know, be pleasured and to be pleasured. So me have to bathe. You have to have a fresh body to do all of them things that you can't. Nobody not gonna lick a nasty body. So you have to be you have to be yeah, man, you have to be it, man. You have to be it, yeah, straight up. Big up yourself, Miss Janelle Primus. Thanks for joining. That's my mother-in-law. So I have to watch my words, you know? Yeah, but she know me already. She know Delvin already. Yeah. Yeah, man, Janelle. Thanks for joining. Unscripted. Anything goes. Yeah, so you know, when you're somebody like, you know, a woman don't like a dirty man in the bed. Yes, they don't like dirty men in the bed. So you have to practice proper hygiene at all times. You know what I mean? Yeah, yeah, man. I am the best. Yeah, man, straight up. Yeah, man. Delvin straight up, man. Delvin not go around corners. Yeah, man. When you're eating man like me, when you like to partake in the eating of the vagina and to be eaten, yeah, man. And you like that, no, you have to fresh. You have to fresh. You have to fresh. You have to fresh. You have to fresh, man. You have to fresh up. Yeah, man, straight up. Yeah, man, straight up. So I took a shower and I, you know, shave up nicely and then I come to do the show. So men's health. We're talking about taking care of the penis and the testicle care. Penis and testicle care. And this is very important care. Very important care. So let's start with the penis, right? So the penis is the external sexual organs of the male body. Yeah, the main part of the body. The gland, yeah, sometimes called the foreskin. And especially in our Caribbean country, a lot of men are not circumcised. Yeah, most of the men, especially in our age group, are not circumcised. Yeah, and as a matter of fact, I was not circumcised. I was, you know, I wasn't circumcised as a child. But when I was what, 19 or 18? Yeah, man. Yeah, man, I get sick and tired of that. Pulling over foreskin nonsense. I just went to the urologist and said, cut off that. Cut off that. Yeah, man. So I'm uncircumcised now. Yeah, I'm circumcised now. Yeah, man, I'm circumcised now. So, mm. So a lot of men now, the foreskin covers the penis, right? And the root, which is internal, half of the penis, half of your penis is tucked um inside under the pelvic. Half of it is tucked inside, right? And attached to the pubic bone. So most of the male penis is actually inside. Some of them come out more than some, and some of them is tucked in under. So no two men has the same size. Yeah, every man, their sizes are different. However, the caring aspect of it is still the same. Yeah, man. The tip of the gland is the passage for both urine and ejaculation of semen. Straight up. Penises varies in different size. You know that already. Yeah. Yeah, man. Penises varies in different size. They can be smooth or bumpy or, different, colors. Some of them are, have different colors. Yeah. Yeah, man. Every genitals are unique. Every man's penis, is unique to the individual. It's unique to the individual. And if something should happen to the man, and a woman has to identify the man, more than likely, if there's no head, and the body has been like chopped up, she can identify the man by his penis. That is for sure. She can identify her man's penis. She would be able to do that. I can guarantee that. Yeah, she would be able to identify the man's penis straight up. Big up yourself, my brother Peter Murphy. Thanks for joining Unscripted Anything Goes. The lovely Sonia Roper. Thanks for joining Unscripted Anything Goes. I love you guys straight up. The penis has a sexual function. Everybody know that already. The internal organ. By the way, this is coming from SRH week.ca. So check them out. Yes. Yeah. So the penis has a sexual function. Yeah, man, respect my brother. The external organ is rich nerve endings that can provide pleasure when stimulated. So all of the stimulation around the head of the penis, yeah, around the edges, yeah, those are all as a lot of organs around here, nerve endings that create stimulation to the men when actually targeted to be stimulated, whether it be through fellatio or using lubricant and massage it around, or even use the hands and stroke it, or even use the vagina to actually rub upon it and stuff like that. It creates stimulation. Yeah, it creates stimulation. And erection is the stiffening and rising of the penis. You all know that already. Yeah. It generally happens when someone gets aroused, sexually aroused. So when a man gets sexually aroused, then erection now occurs. It can happen in non-sexual ways or even sexual ways. Sometimes it don't even need stimulation to actually stand up. Sometimes it stand up on its own. Yeah. Yeah, man, straight up. Yeah, man, straight up. Crystal Vessel, thanks for joining Unscripted Anything Goes. I love you, girl. Thanks for joining. Yeah. A common genital alteration is practice of circumcision. You know that already. Circumcision is when you remove the foreskin from the top of the penis, because the penis is covers the head of the penis, yeah, as a protective device. But if you now take off the foreskin, what happens is that it now become callous. Yeah, it become a callus around it, where the nerve endings now becomes hard, and it still stimulating sexually. However, it won't cause pain. However, if the foreskin is on it now, it keep that sensitization, and any little thing that disturb it or touches it in any aggressive way can cause pain. Straight up. So the foreskin is removed as part of the foreskin is removed. They call that circumcision. and in a lot of cultures they practice circumcision. Yeah, and even if you're not in a cultural setting, it's a lot more healthier when you remove the foreskin, because then it cleans easily, and the callus of it now, because of that sensitization now, that desensitization, yeah, it's not easily exposed to bacteria. Straight up, it is done in many cultures, religion, and sometimes for medical reasons. For those who are not circumcised, yeah, the separation of the foreskin can gland happen around puberty, or should not, some around puberty. Some people, there's a foreskin gland there, right? And this happened to me when I was younger, and I didn't even know where how to handle it. Yeah, there's it's like your virginity is being removed if you're not circumcised. So you can always pull it over and then pee or whatever. But when you reach around puberty age and you pull it back, it's like a tear occur inside. Yeah, like a tear inside occur inside, and it causes real pain. But after a while, it heals and it feels better. So it's a separation of the foreskin gland. It's a separation of the foreskin gland. So it causes pain, but you heal, but you feel normal afterwards. Straight up. Yeah, man. So that is the penis, the erection of it, and the foreskin. And when you move down further, it's the testicles, the male testicles. Most male men have two testicles that hangs in the scrotum. So the balls here, if you don't know what scrotum is, the balls. Yeah, it has two testicles. Yeah. A pouch that has a skin found under the penis. Yep. And it's common. It is common for one testicle to hang lower than the other. Yeah. So sometimes you have the two balls or the two testicles, and sometimes it hangs in one sack. Yeah, one sack. Sometimes it hangs in one sack, or sometimes it separates where you can basically see the two sacks with the two balls in two different each. Okay, Peter. Oh, your circumcised since you were 7. Okay, yeah, man. Yeah, man. Straight up. So, question: if the foreskin is not removed, is it more sensitive or less sensitive? All right. If the foreskin is not removed, it's more sensitive. Yeah, it's a lot more sensitive. Yeah, a lot more sensitive. And, maybe the man can receive a little bit more pleasure from that. Yeah. But it's a lot more sensitive. Lot more sensitive. Yeah, anything you'll feel the pain. Anything you will feel the pain. And not only that, it can become it's easier to dirty too. It's like a raw skin. Yeah. So, and because it is covered now, it get this what Jamaican call cheesy. It get cheesy quicker. It get cheesy quicker. Yeah, if it's not washed and cleaned on a regular basis, it develop this it's just like the vagina when it cleans itself through that whitey thing you see there. It's the same process as the man, because it's covered over. It now tries to clean itself by creating this whitey film around it now, or to clean itself, or to let you know you need to clean it. Yeah, straight up. Yeah. So it's a lot more sensitive, and if you don't clean it on that regular basis, then it would start to get smelly. It start to develop this cut-like feeling. Cut-like, see, it's like spoiled meat. It starts to spoil itself. Yeah, man, straight up. I have to love you. I swear. Yeah, man. Yeah, man, straight up. It starts to get like spoiled meat, So you have to watch yourself, man. No, you might wash yourself, especially if you're circumcised. Wash yourself more frequently than after. Yeah, man, straight up, yeah. And no woman want to suck. Suck that. No woman not to suck that. No woman. No woman is not going to suck that. Even you as a man wouldn't suck it yourself. You wouldn't suck yourself if you could have sucked yourself with that dirty thing. No, so wash it. Please wash it. Keep it washed. Keep it washed and clean. Yeah man, yeah man, yeah man, straight up. Yeah, it also produces important hormones like testosterone. That is where the testicles. Yeah man. Everyday habits can make a big difference in our level of genital health and comfort. This section that we're gonna go into now is gonna teach us about tips to maintaining a healthy penis and healthy testicles. Yeah man, straight up. Yeah man. The beautiful, the lovely Janet Smith. Thanks for joining Unscripted. Anything goes. Yeah man. So you have to know when you wash the penis, man. You have to gently wash your penis every day. Yeah, man. If you don't want to bathe, wash the penis. Even if you don't want to bathe, wash the penis or get a piece of wet cloth and wipe it. Wipe it. Yeah, man. Yeah, man. Yeah, man. If you have a foreskin, you carefully pull back the foreskin and under this foreskin, you clean it, you wash it. Yeah, as well as the tip of the penis. You're supposed to wash the tip of the penis all the time. Yeah, man, if you go to use a washroom and you take a pee, yeah, just like the woman them wipe when time them finish pee, that's the same way you're supposed to actually clean the top tip of the penis as well. Straight up. Yeah, man. Yeah, man, you use water or gentle soap. Nice, soft soap. Yeah, man, don't use anything with too much fragrance in it. Yeah, man, there is no need to scrub this sensitive area. So you don't be scrubbing it like, say, you're scrubbing a pot. No, you don't scrub it like you scrub it a pot. You just gently, use your hand. I wouldn't use a rag. Just use your hand and soap it, the area, and wash it. That's good enough. Delvin, what is the latest age a man can get circumcised? No, man, you can get circumcised at any point. Yeah, I got circumcised later. It's more recommended that you do it when you're a newborn. I think they say 7 days after birth you're supposed to really do it. But some people wait until they're 7. It all depends on what your religious belief is. A lot of people follow their religious practice, but you can get circumcised at any age. Yeah, you can get circumcised at any age. I got circumcised when I was 19. Yeah, man. I got circumcised when I was 19. Yeah, I'm sick and tired of that foreskin. Get rid of it backside. Yeah, but because it's at that age now, when I did it, cut it off. Yeah, it hurt. Yeah, because now you have to now get it desensitized. So because you just remove this foreskin and it bears and it's not desensitized, it causes pain. And not only that, the scab that developed from the cutting of it, you're cutting off your skin, basically you're cutting off the skin. Yeah, it hurt. Yeah, but after that, oh God, it was okay. Now it can bounce around as freely as possible, and it don't bother me. Yeah, it don't bother me. You understand? And a lot of women now, a lot of women prefers to actually give a man fellatio with a circumcised penis. Yeah, they don't too like the ones that are not circumcised. Some women like it. They probably, if they're used to it, that's what they like. But most women prefer when you're circumcised, because then it's a lot easier to access. Yeah, than to have your tongue sliding all over that foreskin. No, when it's not there now, it's easier for her to use her mouth and deal with it the right way, the proper way. But women work with what you have. You know what you have already, you work with it. You work with it. Yeah, man, you work with it. Yeah, man, please your man. Please your man. Yeah, straight up. Yeah, man. So, you take the soap and, nice mild soap, and you actually clean it and wash it with water. That's pretty good. after you clean it, you gently pat dry the tip of the penis, you know? Pat dry it. You don't need to have to take a towel and, you know, like rake it. You shouldn't rake it. Just pat dry it. You know, under the foreskin, if you have under foreskin, you pat dry it, you know, you pat dry it just the same way. You know, you replace the foreskin over the gland before you put in under the underwear. So don't leave the foreskin uncovered before you put it in the underwear. Cover it back over and then put it back in. Yeah, man. So that's how you wash it and that's how you put it back in. But even if you decide not to take a shower, wash it. Yeah, man, wash it. Wash it. Yeah, but you should be showering every day. Yeah, shower every day. So she can suck a nice clean penis. Yeah, straight up. Yeah, man, straight up. Yeah, man. You can take good care of the delicate skin of the penis by using lubricant during masturbation. So if you're one of those person like Delvin that likes to masturbate, yeah, if you like to masturbate, then what you should do, or you don't like masturbate, okay. If you're one of those men out there that like to masturbate like Delvin, yeah, it's best to use the lubricant to actually when you masturbate, other than to rake it, because when you rake it, if you hold it too hard or you stroke it too hard, yeah, what you do is that you're compressing, you're now compressing tightly the urethra area there inside where the pee and the sperm come out. And if you hold it too tight and too tightly, you can actually cause damage to the lining, which is the urethra inside of it, and then you can have what you call now semen leakage. Yeah, you can have semen leakage, or you can actually have pee leakage. Yeah, urine leakage, and you don't want that. You don't want that. So if you know you're going to masturbate, men, try and use some lubricant, or don't hold it as tightly as you do, so you don't create any damages. Yeah, man. Yeah, man. Big up yourself, Anne-Marie Akins. Big up yourself, my brother Trigger. Thanks for joining Unscripted. Anything goes. Yeah, man. So you got to actually, use the lubricant and then masturbate if you're gonna do that. Or if you're gonna do sex penetration, you use lubricant or make sure the vagina is wet. Yeah, because the dryness can actually create a viscosity that cause you to get cuts as well if it's not wet properly. Or you go the old way, traditional way. No lubricant available. You use spit. Use spit, man. Nothing wrong with spit. I use it all the time. Works. It works. Use spit. Yeah, man. Yeah, man. Spit. Yeah, man. Use what you have. Yeah, man. Or by wearing underwear. Underwear. When you wear underwear that have nice soft fibers and cottons, and that will actually create comfort rather than discomfort. Nothing too tight. Nothing is too tight. Shouldn't wear any underwear that is too tight. I would suggest you wear boxers because they are a little bit looser. But the underwear now, if it's too tight now, it actually kills the sperm inside of the scrotum. So you don't want that. So you want nice healthy sperm. So you wear loose underwear, and blood flows and circulation would be a lot better with loose underwear rather than the tight up something then brief. Yeah, man. And when you do your laundry, yeah, you have to use gentle laundry detergent. Yeah, gentle laundry detergent. You don't want anything too perfumey or strong scented. Yeah, Yeah, man. You want to use gentle laundry detergent. Yeah, man. And you should also change your underwear very regularly. Change your underwear, man, regularly. Preferably daily. Preferably daily. Yeah, preferably daily. But if you don't change it daily, try to change it regularly. Try to change your underwear daily. You would think that this is something that you wouldn't or shouldn't you wouldn't think you would have to say that to a man to change your underwear. But I'm sure a lot of you ladies actually implore your man from time to time to go and bathe and to actually change your underwear. I'm sure about that. Yeah, I'm sure about that. I'm sure about that. Yeah. I remember one time we were playing soccer and yeah, we're having a conversation in men conversation. Yeah, man. And I hear a man say, him just play soccer, finish play soccer. I say, boy, him not bathing tonight. You would think that you would want to go home and bathe tonight because you don't play soccer. But him say him not going and bathe tonight. I hear some of the other man, yeah man, me not go home and bathe tonight either. Yeah man, me not feel like more and bathe. Come on. No man. Come on. That's just yeah, that's just outsider nastiness. No man, go change your underwears. Yeah, so try to change your underwear on a daily basis, man. And try to take the shower every day. Yeah, man. Yeah. Yeah, man, straight up. Please, wait up there. The battery can are dead. Hold on, the people. Hold on. I don't know what's going on. Let me try and fix this thing. Yeah, sorry about that. Sorry about that. Let's get this. Alright, there we go. Alright, this can I did. I'm gonna check the source, the main source, to make sure it's plugged in properly. Oh, that's the problem. It's not plugged in properly. Alright, we should be good now. Yeah. Yeah, man. Good evening, Sharon Shepherd. Thanks for joining Unscripted Anything Goes. Yeah, man. I love you, girl. My brother Frank, thanks for joining Unscripted Anything Goes. I love you, my brother. Thanks for joining. Yeah, man. So straight up. So you must change the underwear, if not every day, as often as possible. Please, it's very important. Yeah. And yeah. So it says here, change your underwear regularly and change out the wet bathing suit or workout clothing promptly. So if you know you go to the beach or the pool or you go to the gym, as soon as you get home, get rid of those things. You don't want to create the shift, what do you call it now? Create the thing where it now become fester. You don't want that to happen. So you get rid of those wet clothing. The heat and the what do you call it now? The heat mixed with the wetness can now create like a shift environment under there. You don't want that. Yeah, man. Eating celery makes you come a lot. Facts. And ladies love it. Oh yes, am I youth? Eating celeries. Yeah, man. Yeah, man. Yeah, man. And ladies love it. I eat a lot of protein, man. Eat protein. I try to eat protein all the time. Cause Delvin is a man where have sex every day. I have to have it. If I don't have sex, intercourse, I have to masturbate. So yeah, I have to do something. I have to do something. So yeah, that is how my body works. My body likes to have an orgasm. So I have to eat a lot, regular, Yeah, so yeah. So I eat celeries too. So I guess the celeries help. Yeah, the celeries help. Yeah. Yeah, man, straight up. If you have a high sex drive like Delvin, the good thing is that I have a wife that have a high sex drive too. So yeah. Yeah, man, every day I have to do something. I have to do something. If Jacinta don't want sex, then I have to masturbate. Oh God. It's great too. It works. Works. Something must be done. Yeah. Yeah. Yeah, man. A lot of people in this room is like that too. A lot of people in the room in that. 90% of the women them in the room Yeah, they like to orgasm every day. Mm. 90%. Yeah, listen to Delvin. 90%. Yeah, serious thing. 90%. Yeah, straight up. Yeah, they're just like Delvin. They steal it. You think a joke, a real thing. Yeah, it's important for you to wash your hands before you touch your penis. Yeah, man. You go to the washroom, wash your hands. Yeah, man. Wash your hands. Oh no, I know. You don't. Yeah, because you don't have a partner there with you to have sex all the time, and I don't know why you wouldn't masturbate. Masturbate, man. Touch yourself. It's beautiful. Nothing wrong with touching your own self. It's healthy. You cannot get any STDs or STIs from masturbating. Touch yourself. It's healthy. Touch yourself, man. It's yourself. Touch yourself, girl. Yeah, you'll be surprised. You'll be surprised. Yeah, you'll come. You'll come just the same. Yeah, even better too. Because at least you know yourself and what makes you come. Sometimes you have sex with a man and him can't make you come. But you know to make yourself come. Touch yourself, man. Yeah, man, touch yourself. Yeah. Yeah. So it's important, men, to wash your hands before touching the penis. Yeah, man. Because your hands have so much bacteria on there. You can actually now transfer those bacteria that can cause a fungus. Yeah. Onto the penis. So wash your hands before touching the penis. It's very important. Wash your hands. Especially you have been handling anything that might irritate your penis, like, chemicals, peppers, eat rubs and muscles, muscle pain rubs and all of these things. Yeah, you're cooking, you use seasoning and all of these things. Yeah, or you're at work, where you do construction and all of these things. Yeah, man. Bacteria gets on the fingers, the fingernails, the hands, and all of these things. So it's very important before you pee to wash your hands. Before touching the penis, wash your hands with soap and water. And get rid of that, and then you can touch it. And then pee. And then you wash the head of it after you finish peeing. Wash the head of it. Yeah, straight up. Yeah, man. So start doing a monthly examination of your testicles. Yeah, man. Just like the women, them have to do breast examination and examine their vagina. Yeah, it's the same way. Men, you must examine your testicles. Yeah, it is a good way to become familiar with the shape and the feel to be able to detect any unusual lumps. Because you can have testicular cancer. Yeah. So you can actually determine that something is outside of the ordinary with your penis. So you must examine your penis. Try to do it at least once a month. I would say do it every time you shower, which is daily, I hope. Yeah. So you examine the testicles to make sure that there's no lumps, no burns or, anything unusual, the shape changes or anything like that. Yeah, examine your penis. Yeah, man. Touch your penis. Touch your testicles. Yeah. Straight up. Yeah, man. Testicular cancer is more easily treatable when it is caught early. So if you can examine and notice that, there are changes with your testicles, yeah, you go to the doctor, and the doctor can actually, send you to a urologist to test for testicular cancer, or they do the blood test. And if you do have testicular cancer, then it can be treated if caught early. And so a proper examination of your testicle is very important. So yeah, man, feel up your testicle. Look at your testicles. Make sure that Everything is, there's nothing unusual about it. Any lumps you feel, go and see a doctor right away. Go and see a doctor right away. Please, go and see a doctor right away. Yeah, man, straight up. You know, you have to see a healthcare provider, man, if there's any discharge coming out of your penis. Yeah. So if you're one of those men that have semen leakage, like I talked about earlier, yeah, you know, or you have like painful urination, you know, you see bumps around the head of the penis, or you see bumps around the scrotum area, yeah, or you see a sore, or you see itches, or little fine bumps, you know, it is important to, you know, to go and get tested to check if you have any STIs, sexual transmitted infections, used to be called sexually transmitted diseases. So yeah, so you make sure that you examine it to see if any of these things, and you go to the doctor and get your full physical done to check for all of these things, you know. But it starts with you in your examination of your penis and scrotum. You check to make sure that you don't see any unusual discharges, you know, coming out, or you don't have any painful urination, or even you know, unusual sperm discharge. This, you know, check the smell of your sperm just to make sure that, you know, it is not an unusual smell as the normal smell. You got to check these things. Yeah, man. Yeah, man. Yeah, man. Straight up. Big up yourself, Trika. I love you, girl. Thanks for joining Unscripted. Anything Goes. The beautiful Joy Arden. Thanks for joining Unscripted. Anything Goes. Yeah, man. Yeah, man. So you have to be on top of your penis. Yeah, what I'm ready to say. You have to be on top of your penis health. Yeah, you got to be on top of your penis health. Yeah, man. Yeah, man. Take hold and charge of your penis. Yeah, man. Big time. Yeah, because if you don't, yeah, man, the consequences can be severe. You know what I mean? Yeah, man, the consequences can be severe. You know, if you have any itches, or, you know, your penis is clean, but you're feeling itches, that could be a sign of an infection. Yeah, you're being infected with something. So, you know, you got to check it out. Yeah. Yeah, man. You got to make sure that, you know, when you're peeing, you don't feel any pain. If you start to feel pain, that could be a sign that you have an infection as well. In the urinary canal, you know, there could be an infection there, straight up, or something along the prostate area could cause, you know, problems. Yeah. And inflammation of something could be there. So you got to make sure that anything unusual, you go and see the doctor right away. What happened to you yesterday? Yeah, man, Trika. Yeah, I was telling people I was tired. Fell asleep. Yeah, man, Delvin fell asleep. I actually went to see my daughter a couple hours away, and then drive 2 hours, go there and spend the day with her, and then drove, come back, came back, prepared the lecture, laid down, you know, voiced a couple songs with my son and his friends. We were in the studio voicing some songs, and then I went and lay down for a little bit to say I'm gonna get up, and my God, I was tired. I was knocked out. Yeah, so my apologies, but I'm good for today, because today I slept most of the day. I slept most of the day. Yeah, you know them feelings there. Your body just locked down. You know, you just want to sleep. You know, you just want to sleep. And Delvin read a lot, and you know, so sometimes the eyes them just get tired. The body just get tired, weak, and just say, you know, you've been doing too much. Go to sleep, and it locked me down. But Delvin is good today. I am good today. Look up, me bright. The eyes them bright. The face them bright. Me ready. Yeah, man, straight up. Yeah, man. Yeah, man. Yeah, man, there's no cure for sleep but sleep. When anybody wants to sleep, go and sleep. Yeah. Yeah, man. So, yeah, if there's any swelling or pain in your scrotum area, yeah, go and see the doctor right away. Okay, so if you feel there's any pain within your testicles, the balls, or anything around that area, yeah man, go see the doctor right away. Go and see the doctor right away. Yeah man, go and see the doctor right away. It could be anything prostate wise, testicle wise. Yeah, go and see the doctor right away. See the doctor right away. Yeah. If you are in pain, after trauma with the penis, because sometimes you can bump the penis into the wall, or on a couch, or even on the bed foot, you know what I mean, or even on your partner's feet or foot, or even your partner just ride you too hard. Your wife ride you too hard right off that. Yeah man. Yeah man, some girl has some stallion when them are riding up. You know what I say? Or her teeth might, cause a little to puncture you, most of the girls here, when you fellatio your husband, you know what you're doing, but some people are amateur. They don't know how to control the teeth properly. But yeah, so if there's any swelling or pain, yeah, so if you have any form of trauma of the penis, yeah, it's important to go to see a doctor, to make sure that you haven't caused any blood vessel damages or anything like that of to be concerned with, or it's not anything that will have a long-term impact. Go and see the doctor. Yeah man, straight up. Yeah, well, you can't manage. You can't. Yeah, or even the zipper. Yeah, you're right about that, my brother. I never thought of that. Yeah, you're right about that. Even the zipper can get caught into the skin and cause trauma there. You're right about that. Yeah, that is even worse. That happened to me a couple times. I have to take my time, and it hurt to pull it out. You know what I mean? And then you use some disinfectant, yeah, some peroxide, or, what you call it, rubbing alcohol, and, deal with it. So you don't get an infection. Yeah, but you're right about that. I never thought of that. The zipper can actually cause that kind of trauma and fracture your thing. So any form of trauma that you receive through on the penis, yeah man, try to make sure that you go and see a doctor to make sure you haven't done any damage to it. Yeah man. try to do that. Yeah. Yeah man, straight up. Follow up with the healthcare provider. Yeah man. A firm bump into a heart service, yeah, that can cause it. As I said, your partner riding it too hard. Pop! Yeah, you have some girl, man, a real stallion rider them. I remember one time I meet this girl, man, they call her Wire. Yeah. When she was riding, I'm saying, what are you doing, girl? Yeah. Well, you want to show me you're a gymnastic. You're a gymnast? Yeah, yeah, man. She bounce like crazy. I say, like, maybe it's doing something for you, but it's not doing anything for me. Yeah. You understand? You might learn how to ride properly, man. You know what I said? Straight up. I had to teach her how to enjoy riding and get pleasure from it. Because what she thought she was doing, she thought she was impressing me, but she wasn't doing anything, and she wasn't feeling anything. So I said, what did I do for you? She said, oh, she think it's doing something for me. No, I'm saying, no, it has to be sensual. You have to know what you're doing. Yeah. And then I said, yeah, man, try this. Don't you feel something? She said, yes. Yeah. So that is what you want to feel, something, because when you feel something, chances are I am feeling something too. Yeah, you have to do what you do. You understand? So as I'm saying here, like this, those things can actually cause trauma to the penis if it's not done properly. Imagine she go up and it slip and then it hit her pubic bone while she come down on it. She fractures the penis. You understand? So you got to know what you're doing. And if this occur, yeah man, you feel like you may have caused a sprain, because it's a muscle. So it can actually be painful, real painful. For days it can be painful, sometimes even a month. Yeah. So go and see your doctor to make sure that no inflammation develop. And if so, he gives you the antibiotics to treat you properly. Yeah, and bring you back. I tell you to get to send you to a specialist to straighten you out. Yeah. Yeah man, straight up. Big up yourself, Paulette Blair. Thanks for joining Unscripted. Anything goes. I love your girl. Yeah. Yeah man. So on the pelvic bone of the woman it can actually get fracture. Or you cannot be at work, and for those people who don't do construction or anything, you run into some steel or pipe or bricks or anything that can cause trauma to the penis. So if anytime you have a trauma done to your penis, go and see the doctor, please. Yeah man. So erections are important part of what keep the penis healthy. So you make your penis, you have to get your penis erected. Yeah man, the healthier the more your penis is erected, is the healthier the penis is. At least it's working. You know it's working. Yeah, so you have to get your penis erected and healthy. Yeah man. And somebody sent me a thing. So a penis thing with a man from Trinidad, telling you about ways that you can actually keep the penis healthy, have a great erection and stuff like that. And he was saying that you should massage your penis with coconut oil. Yeah, you should massage your penis with coconut oil, and you can tie the avocado skin around it, and that will actually allow you to have a healthy erection. If you're only person like Delvin, or highly sexually motivated and aroused like Delvin, yeah, I don't have to do that. Mine is always ready to go. It's stand up. Yeah man, I'm always think about sex, always thinking about it. I want it all the time. I was born to have it. Yeah. Yeah. So by that always ready to go. Yeah, but all when I'm done have sex now, I ready to go again. Big up yourself, Andrea Bygrave. I love your girl. Thanks for joining Unscripted. Anything goes. Yeah man. So erections are very important part of to keep the penis healthy. Most people have erections during their sleep for that purpose. So the penis get erected while you're sleeping. Yeah. To keep the blood circulating and flowing and keep it healthy. So even if you are not having sex, the penis find a way to actually keep it healthy. Yeah, if you notice that your penis is not standing up, yeah, it is unhealthy. It's supposed to be standing up. Yeah, standing up, straight up. Yeah, man. Yeah, man. Some people who have suffered trauma to the nerves or the blood vessel damage caused by diabetes or physical, or anything physically, they're unable to have an erection. Yeah, so if you have suffered trauma or you have damage to the blood vessels, so it can't send the blood pumping up into it to create the organ to create the erection, or you may have diabetes, or you may have something physically done to your penis traumatically from a trauma perspective. Yeah, those people sometimes get an erection, or sometimes they have problems getting erection. So that's an unhealthy penis. Yeah, so you have to know, be in touch with a medical practitioner to help you in your situations. Yeah, straight up. But if you don't have a medical problem that you're unaware of, yeah, your penis should be standing up. You shouldn't have any problem getting an erection. If you find that you have problems getting an erection, you need to go see a doctor right away to get it looked at and checked out. Straight up. Yeah, man, straight up. But check out your penis. Yeah, man. Nothing wrong with it. Mm-hmm. Yeah, man. So my wife is always saying, so what if your penis not working? Me say, my penis not working? Yeah, if my penis is not working, I am going to get whatever help I need to get it stand up. Because I need it to stand up. I need it to stand up. I need it, man. I need it to stand up. Whatever it is, I would take it to get it to stand up. Whatever medical advice I need, I would go and get it right away so it can stand up. If I need to take Viagra, I will. Because I need it to stand up. I rely on it. I love what the pleasures that comes with it. Standing up. I need it to perform. Yeah, and that is the mentality that you must have when it comes to your penis. Yeah, you want it to be functioning properly. So anything unusual with it, go and see your medical practitioner immediately. Yeah, man, big up yourself, First Lady Debbie. I love you, girl. Thanks for joining Unscripted. Anything goes. Yeah, man, we're talking about penis and testicle care. Yeah, if a man cannot have an erection, life done. Life done. You see what I'm trying to say, Debbie? Yeah. Yeah. You need it to stand up. You need it. You need it. I need it. I need it. I have functions to perform with it. Erected. I have to penetrate my wife with it. You understand? So I need it. I need it. And not only that, the pleasures that I get when it's erected, yeah, I enjoy those pleasures. So you must have proper health care where your penis is concerned. You go to the doctor and you make sure that you get proper physical done to make sure that it's in good standing. You know what I mean? You get them checked for the cancers, testicular cancers, your prostate cancer. Yeah, you get all of these things done to make sure that it's in good working order and that you don't have any STIs. Yeah, straight up. Straight up. When the man them there. Yeah, man, you see what I'm trying to say, girl? Yeah. Yeah, man, yeah, man. If you don't have it in the waist, you will have to have it in the face. Yeah, man. As a matter of fact, you need to have it both ways. You have to be able to eat the vagina properly to please your woman if that's what's pleasurable to her. You have to be able to eat it properly, yeah, so she can have an orgasm if that's what brings her to an orgasm that way. And if penetration is what brings her to an orgasm as well, you have to be able to penetrate her properly so you can do it. Some women like both, yeah. So yeah, so if you're one of those women out there that like both, yeah, Delvin have no problem pleasing you, and your man shouldn't have a problem pleasing you. You understand? So, but in that area, our man gets an orgasm is through that. So they need that to be working to get the orgasm. So I need it. And I would do anything possible to make sure it's in good working order. That's why proper care of your penis is so important. Because if you neglect to take care of it, you're going to have and something develop that should have been taken care of, yeah, over the long haul and period, you're going to wish if you would have taken care of it, because now you're going to have deep problems. Straight up. You have to be eating healthy. Yeah, you have to eat healthy. Proper healthy eating is a must. Yeah, you have to know, reduce your alcohol consumption, reduce smoking habits, and now focus on proper hygiene. Straight up. Proper eating healthy habits. Yeah, you have to have proper eating healthy habits. Go more to a plant-based eating, because then you get better blood circulation when you go plant-based, and then you're able to now send the blood up inside of the penis and you get good erections. Straight up. Yeah, man, this whole heap of sugar thing nah go help. Yeah, go low on sugar, go low on carbohydrate, and go more high on protein and fiber. And then that will keep your blood circulating properly. And then you would always have good orgasms. Yeah, man. I don't have any problems standing up to attention. When Jacinta want that thing, it's supposed to be ready. And even if she don't want it, when I need to masturbate, it's supposed to stand up so I can masturbate properly. You understand? I can't have the feeling and then the penis don't react to what I'm feeling. What an embarrassment that is. Yeah. Imagine you feel horny and then the penis just not standing up. Imagine that. Yo, what a disgusting feeling. Yeah, man. Yeah, man, cut down for the alcohol, man. Yeah, man, straight up, you're right about that, Debbie. Yeah, man. Yeah, man, straight up. So you got to make sure that you have proper healthy eating habits, as Junal just said, so that you can actually maintain a healthy penis. Yeah, man, straight up. Yeah, man, healthy penis good. Ask the ladies. You guys know it. You guys take it. So you know that. Yeah, man. And my wife, she like a hard, when my thing hard like rock. Yeah, she don't want to soft something. Where you go with that? No, she want it hard like rock. Yeah, so I have to make sure that my health is properly taken care of so it can be ready for her. Yeah. Yeah. It can be ready for her. So likewise, you should make sure that your penis is healthy, man. Please. Yeah, man. Examine your penis. Please. Yeah, man. Eat healthy. And please, anything unusual, go and see a doctor. Yeah, man. What it feels like when you're honey. Okay, when you're honey and it's not stand up. Oh, I don't really have them problems still, you know. My thing always stand up. But I know it would be an embarrassment. Yeah, I know it. Yeah, I remember a girl saying, you know what, she tried everything to make her man penis stand up. Yeah, everything to try. She sucks until she weak and nothing is just not happen. She feel like, you know, something is wrong with the man. And she keep telling him to go to the doctor and he wouldn't go to the doctor. Yeah, and she said he was a Jamaican man, you know, who don't do cunnilingus. He don't do cunnilingus. And when he reached to the point where he realized that nothing that she does is causing it to stand up, and he felt at that point that, guess what? She possibly could go out on the street now and get somebody now to please her. Yeah. What he did? She just saw him using his mouth. Yo! He now resort to the mouth pleasuring of her vagina. And she said, how many years she's been waiting for him to please her in that manner. And it took for him to cannot rise to the occasion for that to happen. Yeah, you see what I'm trying to tell you? It take for that point. Yeah. And even in her mind, she thought that, you know, she would remain loyal to him. Yeah. But in his head, the fact that he could not now stand up to the attention to please her with the penis, he thinks she's gonna go outside. So what he had to do now is to use his mouth. Yeah. Yeah. And look how many years he wasted not pleasing her in that manner. And it took that for him to resort to doing that. Yeah. She said eventually she left him. She left him. Yeah, she left him because he didn't respect her and respect what pleases her. You understand? And it took for him to not stand up for her to get that pleasure. Therefore, yeah, he's not doing something based upon to benefit both of them are concerned with her pleasurable desires. Yeah, he's just looking out for himself. So eventually the marriage fell apart and she left him. Yeah, she left him. What a thing. What a thing. Because that thing that he relied upon, he never practiced proper health care of his penis. And it was his only thing that he could do, or he was willing to do, until it failed him. Until it failed him, where he had to resort to cunnilingus. What a thing. Yeah, man. Big up yourself, Valen Richards. Thanks for joining Unscripted. Anything goes. Whenever men can get stand, they become real, evil, and aggressive. Why? Whenever men can't get stand, they become real, evil, and aggressive. Okay. I don't know. Whenever they can't stand up, they become really aggressive. Evil and aggressive. I don't know why they should become evil and aggressive if they can't stand up. They shouldn't. Maybe they're too anxious or too pushy or whatever. They need to whatever. Or if they now realize that they can't get an erection, that is not the end of the world, Because yeah, man, big up yourself, First Lady D-Mac. Thanks for joining Unscripted. Anything goes. Yeah, and it's not the end of the world if you find that you just can't get an erection. No, the doctors out there have products that can help you to get an erection. Yeah, your blood flow might not be strong enough to pump the blood, or what happens is that your prostate, you have problems with your prostate, or it just worn out. You can take Viagra. Yeah, you can take all of these drugs to deal with erectile dysfunction, and you can stand up again. A lot of old men now are now investing in Viagra and are having healthy sex again. So it's not the end of the world to if you see that it's not working. No, man, go to your medical practitioner and they can help you. Straight up, they can help you. Yeah, can help you. Yeah, man. If you need a little help with something, take it. Yeah, man, take it, man. Take the help. Take the help. It can only help. It can only help. Go to see a doctor and let them know. Insecure, cause them can't stand up because it can't stand up. Yeah, or maybe them just don't go doctor. They just don't take care of them health, and them shame to go to the medical practitioner at that point to say, you know what? Yeah, it's just not working. No, that is when you should be running and asking for help. Yeah, running and asking for help and get the help so you can get it working again. Yeah, man. Yeah, man. Go see the doctor. Where he said pineapple is good for your blood flow. Okay. Yeah, pineapple. Yeah, yo, brother, you know a lot of things about the food eating thing, which is good. Yeah, so I respect that. Yeah, so not pineapple, what do they call it? Watermelon. Yeah, watermelon. Blend up the watermelon. It's good for the blood flow. Yeah, man. Straight up. Yeah, I read that too. Yeah, man. Blend up the watermelon and eat. Yeah, man. Drink it. Good. They would need porridge. Yeah, man. Healthy sex with Viagra and a heart attack. I mean, if you have heart problem, then I mean the doctor will actually work with you where that is concerned. But if you don't have a heart problem, yeah. If you don't have a heart problem, and even if you have a heart problem, they can actually help you monitor your health situation and give you the proper dosage that you need to deal with that. Yeah. Or you may not need to do it take the Viagra every night, but maybe you can take it once a week or once a month. At least you're getting something. You won't be getting it like Delvin every time, but at least you're getting it sometime. Yeah, man. Sometime you're getting it. You understand? And masturbation helps to keep the blood flow circulating to you. So even if you're not having sex, you should be masturbating. I do it all the time. I enjoy doing it. It's wonderful. Very nice. Lovely feeling to masturbate. You ladies should masturbate too. It's very healthy. Yeah. You learn about your body and you can tell your man so that he can do it the way you like it done and please you. Yeah, man, straight up. It keep the blood circulation flowing in that area too. Yeah, man, straight up. So a lot of people think these things are nasty, you know, especially in our culture where they teach you from a younger age that these things are nasty. I was watching, somebody sent me a lecture from a pastor. He was preaching and he's telling people that certain things sexually are actually nasty. God forbid them to do these things, like oral sex, anal stimulation, and all of these things. He's preaching and he's using a scripture in Ezekiel to justify that, you know. So, so God wants to be in your bedroom. Yeah, God wants to be in your bedroom. God wants to be in your bedroom. God is a pervert. God is watching you have sex. I say, no, you're not doing it like how I want you to do it. If that is pleasurable to you, then I don't want you to do it. That is what he must say, God has. I don't know how that is right. So God make you to have these pleasures and then say, don't do it. Don't do it because it's deviling and blah, blah, blah. The devil is making you want these pleasure. You understand? So you got to be careful of, you know, what you deem to be godly or ungodly. Yeah, straight up. So touching of yourself, masturbation, is your own self. Yeah, man, touch yourself. Touch yourself, man. The more you touch yourself is the more you learn about yourself. And the more you learn about yourself is the more you can pass on to your partner. Straight up. Yeah, man. So a device like a vacuum pump, yeah, which make the penis swells with blood. Yeah, so even if you have problem standing up, you can actually use the vacuum pump to actually help pump blood into the yeah, right, into the shaft of the penis and let it get erected. Yeah, it can help maintain a healthy penis if you have a physical problem. So if you find you have problem like that, you can use a vacuum pump to pump the blood so you can have an erection. So if you suffer from erectile dysfunction problem due to depression or anxiety, you know, these things can cause you to not get the blood flow that you need. Seeking support about the issue is important. Yeah, man, go and get help and counseling to deal with your anxiety. Yeah, man, or your depression state, so that you can actually know correct the mental side of your dysfunctional problem. And when you can't correct the mental side and you're in a good state of mind where you can now focus on pleasure, yeah, without interruptions, then things might start working for that organ again. Yeah, man, some of these females are big turn off too because of the smell of their vagina. Yeah, so I mean, if you have your wife in your yard and you notice that there's an unusual smell, whether or not you try to eat it or you smell it during intercourse, yeah, she might not be aware of the unusual smell because it's normal to her. You have to point it out to her, and it's nothing wrong to point it out with her. Yeah, she could be having an unusual discharge, or she could be having a pH balance problem. Yeah, so that has to do with her eating habits and proper hygiene practice. So now she can actually now recognize it, go and see her gynecologist, and that gynecologist can straighten her out, and she brand new again. You understand what I say? And sometimes, you know, my brother Peter Murphy, that smell that you talk about, you know, so most of the time It's not her is the problem why that smell occur. It's the man who's the problem why that smell occur. And I'm going to tell you why. Because the sperm sometimes gets too thick. It's not watery. It can become thick. Yeah, based upon the amount of protein or too much things or lack of that, becomes thick. And when it now goes inside of the vagina, instead of it just coming out, watery like, or run out into the bathroom or whatever, or if she put something there to sap it up or whatever, instead of it just running out normally, because it is so thick, it lines inside of the vagina, and it throw off our pH balance now, where it stays in there longer than it's supposed to, and that now creates that pH imbalance in her, that when you now go there, you now smell that scent, because the body now readjusts itself to tell you that something is wrong. To tell you that something is wrong. And that's why you must tell her, so she can actually go to the doctor and actually deal with the problem. Yeah. So that can create now an imbalance in her pH. Yeah. So that is most of the time. Some of our sperms is just too thick. It's too thick. It don't run out. It don't run out. Yeah. Yeah. So you got to be mindful of those things as well. So we can't just fully blame it on her, but work with her. Yeah, work with her. Yeah, man, it's your woman. You want her to be healthy. So you have to point these things out to her with love. Yeah, with love. Don't be saying your pussy stink. Nah! You don't do that to your woman. She's your woman. Yeah, man. You want her to be healthy so you can enjoy a healthy vagina. So you know have to point that out to her. And both of you go to the doctor. Straight up. And you need to drink more water, men. Drink a lot more water. Drink a lot more water. Yeah, straight up. Tons of water. Good for you. Yeah, man. So so the mental side of it now, you got to get proper help to deal with the depression and anxiety. So you get over that. So you can now focus on enjoying a healthy erection. Straight up. Most of the ways to reduce the risk of peanut cancers is to practice good genital hygiene, cleaning under the foreskin, or if you're not circumcised, you clean it properly so it stays clean and nice. You get your HPV vaccine, for the younger people them who are watching the show. Get the HPV vaccine, and so you don't expose yourself to the HPV virus, man. Or avoid having unprotected sex with people. Avoid unprotected sex, unless it's your wife, or or you trust her and you have unprotected sex with her, but don't be going around having unprotected sex with every person out there. Then you expose yourself to getting these diseases, STIs, and also the HPV virus. If you're having oral sex with the woman who is exposed to the HPV, you can get the HPV from her, So be careful. Yeah, straight up. Have safe sex. Yeah, man, you couldn't tell my ex-wife that if my sperm is very thin, she will swear I'm cheating. Yeah, man, but that is a true cause for it, man. Yeah, man, and that's a problem, We have to learn to actually talk freely and openly when it comes to sex with our partner. I find ignorance shouldn't be an excuse for having an healthy sex life. Yeah. you should be communicating everything unusual so that you can actually prevent anything outside of the norm to cause an interruption in your sex life. And in that case, if you smell something, my brother, yeah, then she should take that, what you tell her, and go and get it fixed. And in your case, if your sperm is thin, yeah, it's nice flow that it's supposed to be, then that is fine. If she think that it being thick, yeah, is what would say that you're not cheating, then she's wrong, because she don't understand how your sperm flow then, or how sperm supposed to flow. You understand? Yeah, you can be taking in too much protein, which cause it to be real thick. Yeah, straight up. Straight up. So you got to she got to actually listen to you, and but unfortunately she's your ex now, so you don't have to worry about that. Yeah. And it's easy for a woman's pH balance to change. Very easy. Very easy. Yeah, very easy. It could be your diet, it could be you, the man, could be stress. Yeah, it could be stress. It could be depression. Yeah, man. It could be too much junk, too much sugar. Yeah, too much carbohydrates. Yeah, could be so many different things. Yeah, it is your woman. Anything can change your pH balance. So you, as a man now, who know your woman, anything, if you smell something unusual, yeah, man, or you see an unusual discharge, tell her. Tell her, man. Tell her. You want your wife to be as healthy as possible for you. So it's incumbent upon you to tell her. Yeah, man. And women, listen to your man. Are you the man tell you about? Tell her. And likewise, women, if you see anything unusual about the man, you taste the discharge and it don't taste healthy, yeah, tell him. Tell him, man. Tell him. Yeah, tell him. Something about it tastes different. Yeah. Yeah. Something about it different. If you notice like any form of, discoloration on his penis, or, you see a lump, yeah, on the testicles, you tell him something could be wrong. Something could be wrong. Yeah, man, people. Yeah, man. So, men, take a shower every day, wash, clean it, examine it, and enjoy a nice, healthy penis. Enjoy a nice, healthy penis. Yeah, man. That is your most gifted position on your body, that penis. And penis is your most gifted part of your body. Believe it or not, that could make or break you as a man. You have to take care of it. Take care of your penis. Take care of your penis. Yeah, man. Any more questions before we wrap up the show? Any more questions before we wrap up the show? Yeah, man. Informative show, nice show, interactive show. Learned a lot, especially the eating habits from Peter, my brother here. So remember, men, to have a healthy penis. Healthy penis is good. Yeah, man. So we're here tomorrow. Remember to share the show, people. These shows are nice, informative show. They help a lot. Yeah, help a lot. So if they're helpful to you, share it to people so it can be helpful to them too. Yeah, remember to embrace conservative values. We don't have badges nor guns. So make sure that we support the police, because we're tax-paying citizens. Until tomorrow, Delvin is telling you, I love you. Yeah, man. I love you. Bye-bye.